8 Common myths about depression. 1. If you think somebody is depressed, the best way to help is to try to cheer them up. No, the above isn't true. If an individual is suffering from this serious disorder of depression, you should encourage them to talk to their doctor or a mental health professional. Just trying to lift their spirits may make them feel misunderstood. Share your support and offer hope that they will feel better with treatment and time. 2. Depression is mental weakness. This stigma is one of the main reasons why so many people elect to suffer in silence rather than seek the help they need. However, no one chooses to develop depression. It is a complex mental disorder that affects a person biologically, psychologically and socially, and does not discriminate. If anything, there is great resilience in the person that feels truly debilitated by this condition but makes an effort to work through it on a daily basis. 3. Real men don't get depressed. Just because women are twice as likely to develop depression doesn't mean men should suffer in silence. In fact, middle-aged white men have experienced the greatest increase in a number of suicides committed each year, and the majority of them can be linked back to depression. Men often express depression differently than women, which make depression among men easier for society to overlook. Afraid of appearing less masculine, strong and stable, men often feel less able to speak up and receive the help they need. This makes depression even more dangerous for men, because they avoid treatment, tend to complicate their condition with substance abuse and are far more successful in suicide attempts, should their condition worsen to that level. 4. You'll need medication for the rest of your life. Depression treatment is entirely customized to the person exhibiting symptoms. Some people use medication for short-term assistance, some stick to a consistent regimen over the course of their lives, and some opt for no medication at all. Several forms of psychotherapy can offer effective treatment. For an estimated 40% of people dealing with depression, it works even better than medication. Experienced doctors run through all of the treatment options with their patients to ensure that they are getting the care that they need and feel comfortable with the route ultimately taken. 5. Talking about it only makes it worse. Because we have treated the issue of depression with kid gloves for so long, it instinctually feels uncomfortable to talk about it at first. But we can't will it away or expect it to heal on its own. By abandoning the stigma associated with the disorder and being receptive to those who are concerned for their well-being or that of a loved one, we are able to initiate the conversation in a proactive, helpful way rather than reinforce destructive, negative feelings. More people will express how they feel before those feelings become more severe, or even fatal, and begin seeking the support they truly need. 6. Antidepressants always cure depression. Depression is treatable. Among other interventions, your doctor may prescribe antidepressant medications. These drugs alter your brain chemistry. They can help address deep-rooted biological issues that may be contributing to your condition. But for many people, antidepressants alone aren't enough. Your doctor may also recommend psychotherapy or talk therapy. Combining medications with talk therapy is a common treatment strategy. 7. Depression is something that strong people can snap out of by thinking positively. No one chooses to be depressed, just like no one chooses to have any other health condition. People with depression cannot just snap out of their depression any more than someone with diabetes can. It is not a sign of weakness or laziness to be depressed, it is a health problem resulting from changes in brain structure or function due to environmental and biological factors. 8. Depression will just go away on its own. While for some people, depression may go away without treatment, this is not usually the case. Without treatment, symptoms of depression can continue for weeks, months or even years. Depression can lead to suicide, the third leading cause of death for 18 to 24-year-olds, reinforcing the importance of seeking treatment. The good news is that most people do get better with treatment.